Welcome in, everyone. We know you are here because you have that drive to really understand complex systems without just getting completely buried in information overload. And that is exactly what we're doing today.
Right, because usually when we talk about a medical diagnosis, there is this expectation of precision. It sort of feels like engineering.
Yeah, exactly. You break your arm, the x-ray shows that jagged white line, and the doctor just points and says, well, there it is.
It's a binary system. The bone is broken or it isn't. We like things to be visible and easily categorized. It makes the world feel predictable.
We love predictable. But the moment you step into the world of neurodevelopment and trauma, that x-ray machine is just completely useless. We're looking at a diagnostic landscape that is incredibly murky.
Oh, very murky.
You aren't looking for a single jagged line on a piece of film. You are looking at a complex, shifting ecosystem within a developing human mind.
And that is exactly what we are getting into.
Yes. Today, we have a really fascinating stack of source material to guide us through these diagnostic muddy waters. We are examining a clinical overview from MentalSpace School, which is a K-12 mental health support system operating directly within schools in Georgia.
Our mission today is to pull apart how modern school systems are tackling complex developmental conditions. So specifically, we are focusing on intellectual developmental disorder, or IDD.
Right.
We really want to map out how a massive educational infrastructure takes these nuanced clinical diagnoses and, translates them into actionable systemic support for kids.
Which is a huge undertaking.
Yeah.
We're going to cover everything from the underlying philosophy of how we define a diagnosis to the mechanical realities of treatment, all the way to the hard data of student outcomes.
And the bureaucracy, too.
Oh, we are definitely getting into the bureaucratic red tape. Things like the friction between medical and educational privacy laws and upcoming legislative compliance deadlines, like the July 2026 mandates in Georgia.
Because you really cannot separate the clinical care from the administrative reality in a school setting. They constantly dictate the terms of each other.
Right. But to understand how this ecosystem operates, we first have to deeply understand the specific condition highlighted in our source material. So, IDD.
Which stands for Intellectual Developmental Disorder.
Right. Historically, in older literature, it was referred to as intellectual disability. Our sources note this is a spectrum condition that begins in childhood.
But the crucial detail piece that shifts the entire framework is that it doesn't just affect reasoning and learning.
Okay, let's unpack this.
Yeah.
Because this is the core of it.
Right. It profoundly affects everyday adaptive skills.
And the text has this incredibly powerful phrasing that I want to highlight. It states that a diagnosis is a doorway to support, not a ceiling on a child's future.
I love that line.
It's so good. Getting a diagnosis in a school setting often feels like getting this rigid label slapped on a student's file, right? It feels restrictive.
Like a box they can't get out of.
Exactly. But if we reframe it as a doorway, well, it functions more like a customized master key.
Oh, a master key. That's a great analogy.
Yeah, you secure this key, and it unlocks the exact doors, the specific resources a student needs to navigate the world. It doesn't lock them in a specialized room. It lets them out into the broader environment safely.
What's fascinating here is that the shift from focusing solely on academics to focusing on adaptive skills is just pivotal.
Right.
Because when we think about school, the default metric is always academic success. We look at math scores, reading comprehension, passing history tests.
The standard stuff.
Exactly. But when a condition impairs adaptive skills, the goalposts have to move. We are no longer just talking about academics.
The source material specifically defines these adaptive skills as communication, daily living, and social judgment.
Right, the real-world stuff.
Yeah, so we're talking about someone's ability to navigate the world independently.
Think about the mechanics of social judgment, for example. It isn't just knowing right from wrong in a vacuum. It is the ability to, read a room, to understand the nuance in a peer's tone of voice.
Or to recognize when a situation is becoming unsafe.
Exactly. A teenager lacking social judgment is highly vulnerable to being manipulated by a bad crowd. And daily living skills dictate whether someone can safely manage a bus route, handle money, or prepare a meal.
And communication is how a person expresses physical pain, frustration, or joy.
By focusing on adaptive skills, the treatment isn't trying to just force a student to memorize historical dates.
Right, it's about equipping them for everyday survival, for social integration, and a dignified life outside the classroom walls.
It centers human dignity over purely academic output.
So once that doorway of diagnosis is open, what exactly is on the other side? How do these concepts of dignity and master keys translate into actual mechanical care?
You mean for a student sitting in a classroom on a Tuesday morning?
Exactly. What does the action plan actually look like?
Well, the sources outline a very specific sequence of interventions following an IDD diagnosis. It always starts with early intervention.
Because catching it early is key.
Absolutely. Catching developmental delays young allows for more neural plasticity and just better long-term outcomes. From there, the system heavily relies on individualized education plans or IEPs.
Let's define the mechanics of an IEP for a second, because it's a term thrown around a lot.
Sure.
An IEP isn't just a suggestion box for the teacher. It is a legally binding document that outlines exactly what accommodations the school must provide for that specific child.
Right, it's mandatory.
Yeah, that could mean extended time on tests, a quiet space to decompress, or modified assignments.
And along with the IEP, the clinical overview emphasizes life skills coaching. This is where those adaptive skills are directly targeted.
What does that look like in practice?
A life skills coach might literally role-play a conversation with a peer to practice social judgment, or physically walk a student through the steps of organizing their backpack to practice daily living skills.
Wow, so it's very hands-on.
Very. And finally, the intervention incorporates comprehensive family support, rooted in what the text calls strengths-based, dignity-first care.
Here's where it gets really interesting, though, because I want to push back on a seeming contradiction in the text here.
Okay, let's hear it.
The overview hammers home this idea of deeply individualized, strengths-based care. Everything is tailored to the unique dignity of the specific child.
Right.
But it simultaneously mandates that the diagnosis must come from a licensed clinician using a, quote, standardized assessment.
Ah, I see where you're going.
How do those two concepts coexist? A standardized test is the exact opposite of highly personalized care. It feels like forcing a complex child into a rigid metric just to check a box.
It is a natural tension, I'll give you that, but they actually rely on one another. Let's go back to your master key analogy for a second.
Okay.
To cut a master key that actually turns a lock, the locksmith has to use a very precise, standardized machine. The machine has to be rigid and objective to ensure the key's teeth are cut to the exact millimeter. If the machine isn't standardized, the key just doesn't work.
Okay, I follow that.
The standardized assessment is that objective machine. In clinical psychology, you need a standardized, empirically validated tool to secure the diagnosis accurately and without bias.
So you know exactly what you're dealing with.
Yes, the clinician needs to know definitively that they are looking at IDD and not a trauma response, severe ADHD, or a different learning disability. The symptoms can overlap heavily.
So the standardized assessment is just the objective tool necessary to secure the diagnosis to get the master key.
Exactly. But once that objective tool secures the diagnosis, once the door is open, the execution of the care is where the standardization ends.
Oh, that makes total sense.
Yeah, the role-playing and life skills coaching, the specific goals written into the legally binding IEP, the culturally competent family support, that is where the individualized strengths-based magic happens.
You must have the objective standard to safely unlock the subjective personalized care.
Exactly.
Clarifies the tension perfectly. You can't personalize a treatment if you don't know exactly what you're treating. But taking that deeply individualized approach and applying it to a massive school population.
That requires a staggering amount of infrastructure.
It really does. Delivering this level of dignity-first care across thousands of students naturally brings us to the provider actively doing this in Georgia.
Enter MentalSpace School.
Right. When you look at the mechanics of what they are offering, it represents a fundamental shift in how schools handle mental health. They aren't just sending a contracted counselor in once a week.
No, they provide dedicated, licensed therapist teams for each school, explicitly trained to be diverse and culturally competent.
And they offer same-day teletherapy.
Which is huge.
If a student is in acute distress, they aren't put on a 3-week waiting list for an intake appointment. The support is immediate.
Furthermore, their scope of practice extends far beyond basic counseling. They handle direct crisis intervention, as well as suicide and violence prevention.
The analogy that comes to mind when looking at this model is that rather than sending a struggling student out into a fragmented, intimidating medical maze.
Which is what usually happens.
Right. Instead of doing that, MentalSpace installs an emotional immune system directly inside the school building.
I like that. An emotional immune system.
It covers the entire ecosystem. It can mobilize immediately, whether that means same-day teletherapy for a student having a panic attack or implementing violence prevention protocols for the broader student body.
And if we connect this to the bigger picture, the most vital part of that immune system might actually be how they treat the adults.
Yeah, the text explicitly mentions staff wellness and family counseling.
By explicitly including those elements, MentalSpace recognizes that a child with IDD does not exist in a vacuum.
Right.
Healing requires supporting the adults surrounding the child. You cannot heal a dysregulated child if the adults surrounding that child are also exhausted or in crisis.
A teacher dealing with secondary trauma or burnout cannot effectively co-regulate a student who's having a meltdown over disruption in their daily routine.
Exactly. A culturally competent therapist doesn't just treat the student, they have to treat the environment the student is adapting to. Supporting the stressed out teacher and the overwhelmed parents is a direct intervention for the child.
But, and this is a big but, an internal system that comprehensive hits a wall the moment you talk about funding and privacy laws.
Oh, always.
A school-wide support system is totally useless if families can't afford it or if it violates privacy laws. How does a program like this actually handle the cold, hard, logistical realities?
The logistical framework they've built is just as complex as their clinical philosophy. Let's look at the accessibility breakdown in the source material.
Okay.
They accept a wide array of private insurances: BCBS, Cigna, Aetna, UHC, Humana, Peach State, CareSource, and Amerigroup.
But the most crucial detail for accessibility, the one that really stood out to me, is that Medicaid patients pay $0 out of pocket.
That is massive.
For a family hovering around the poverty line who has a child requiring intense, ongoing interventions, removing that financial barrier is everything.
Cost is the primary barrier to mental health care, but liability and compliance are the primary barriers for the school districts themselves.
Which brings us to the red tape.
The source material notes they operate under strict privacy standards, ensuring full HIPAA and FERPA compliance.
Let's break those acronyms down for anyone who hasn't had to deal with them, because the intersection of the two is notoriously difficult.
It's a nightmare.
HIPAA is the federal law protecting the privacy of a patient's medical records. FERPA is the federal law protecting the privacy of a student's educational records.
And when you put a medical clinic inside a school building, those two laws constantly collide.
Right. The therapist has a legal obligation to keep the session confidential under HIPAA, but the school administrators often feel they need to know what's happening to protect the educational environment under FERPA.
Navigating that overlap requires incredibly precise data management and clear legal boundaries, which MentalSpace provides. But there is another very specific administrative detail in the overview.
Yeah.
It notes that MentalSpace provides HB 268 compliance support ahead of the July 2026 deadline.
Right. HB 268. This is a specific legislative mandate in Georgia. It essentially requires public schools to formalize and implement comprehensive mental health and school safety protocols by July 2026.
Exactly.
So what does this all mean? When I read that, I had a bit of a cynical reaction.
Really? Why?
Well, we just spent all this time talking about dignity, adaptive skills, and strengths-based care. Does forcing a school to chase legislative compliance, like filling out state forms to meet a July 2026 deadline, does that distract from the actual human care of the students?
It's a fair question. We often view bureaucracy as the enemy of empathy. It feels cold. But in a systemic setting, navigating that red tape is actually a profound form of structural care. Think about the burden on a public school. Administrators and teachers are already overwhelmed with educational mandates. If a school had to invent its own mental health program from scratch,
Oh, man.
right, guarantee the complex overlap of HIPAA and FERPA compliance, manage billing for Medicaid and 8 different private insurers, and ensure they were compliant with HB 268, the system would collapse.
They would spend all their time managing the liability and the billing, and no time actually supporting the kid.
Exactly. By handling the compliance support, managing the complex insurance billing, and offering the $0 Medicaid options, MentalSpace lifts a massive administrative burden off the school's shoulders.
They absorb the bureaucratic shock.
Yes. They ensure legal privacy is maintained, they secure continuous funding, and they handle the state mandates. Because they manage the logistics, the educators are free to simply focus on teaching.
So the logistics protect the care. If the billing fails, the therapy stops. If the compliance fails, the program gets shut down by the state.
Without that invisible architecture of logistics, the most compassionate clinical philosophy in the world cannot survive in a public institution.
Managing the red tape isn't a distraction from the care, it's the foundation that allows the care to exist.
Precisely.
All right, so we have covered the clinical philosophy and the doorway to support. We've explored the mechanics of the interventions and the bureaucratic architecture holding it all up.
But does it work?
Yes, that is the ultimate question for you, the listener. As we look at this case study, does this approach actually work? Let's look at the hard data.
The clinical overview provides some very specific outcome data. We are looking at 89% improved attendance, 92% reduced anxiety, and 85% family satisfaction.
Those metrics are staggering,
Truly.
especially for an intervention operating at a systemic level within the school environment. I want to focus enthusiastically on that 89% improved attendance.
It's a huge number.
If a student is receiving same-day teletherapy and life skills coaching, the most immediate, tangible victory a school can ask for is simply getting a struggling kid to walk through the front doors.
Attendance is the foundational metric of educational success. You cannot teach a child who is not in the room.
Right. And an 89% improvement in attendance doesn't happen just because a principal mandates stricter truancy laws. It happens because the environment they are walking into is finally equipped to handle them.
This raises an important question, though. How do those other metrics interact with the attendance?
Oh, that's a good point.
If you look at the 85% family satisfaction and the 92% reduced anxiety, it ties right back to that doorway analogy.
Right. Because if a child with IDD is struggling with daily living and social judgment, that struggle doesn't stop when the school bell rings.
No, that stress goes home with them.
The entire household is affected.
Yeah.
Parents are managing constant meltdowns, siblings are affected by the disruption, the emotional temperature of the home is just constantly boiling.
But when a culturally competent therapist intervenes early and provides family counseling alongside the student's life skills coaching, you materially lower the temperature of that entire household.
The parents feel supported.
Yes. You reduce the student's anxiety by 92% because they are finally learning how to communicate their needs. The parents feel equipped, resulting in that 85% satisfaction rate.
And when a home environment stabilizes, getting them on the school bus in the morning isn't a battle anymore.
Exactly. The doorway is open and they can finally walk through it.
It is a complete, functioning feedback loop. For anyone listening who wants to examine the mechanics of this exact model further, the source material notes you can find more at mentalspaceschool.com or reach out to them directly at mentalspaceschool@blossmeantherapy.com.
It serves as a highly detailed blueprint for anyone interested in the intersection of educational policy, logistics, and developmental psychology.
So for you, our listener, we hope this deep dive into Mental Space School's clinical overview gave you a masterclass in treating complex issues like IDD through a systemic, culturally competent, and strengths-based lens.
We examined how objective, standardized tools act as the machine to cut the key for individualized care.
And we saw how managing complex bureaucratic red tape like HIPAA, FERPA, and state legislation is fundamentally an act of service that protects the therapeutic relationship.
But before we sign off, there is one final provocative thought we want to leave you with to mull over.
Yes, something based strictly on the text. Our sources explicitly note that intellectual developmental disorder affects everyday adaptive skills, specifically social judgment and communication.
Right.
Yet, when you look at the systemic interventions Mental Space School heavily focuses on, you see things like violence prevention and crisis intervention.
The connection between a fundamental lack of adaptive skills and a resulting crisis is profound.
It really leaves you wondering about the history of education. When you think about the decades of schooling before these models existed, how many intense school crises, how many massive behavioral issues?
How many students were just written off as problem kids?
Exactly. How many of those situations were actually just unrecognized adaptive skill challenges? Kids desperately waiting for a customized doorway of support. But instead, the system only knew how to give them a disciplinary ceiling.
A student acting out violently because they literally had no other mechanism to interact with an overwhelming environment.
It's definitely something to think about. Thank you so much for joining us on this deep dive. We love unpacking the mechanics of these complex ecosystems with you. Until next time.